Hey, this is your host, Jasmine Haley. We're here for another podcast episode. And my guest today is Samantha Veradero. Hopefully, I said her last name.
Yes, you got it. Nailed it.
Yes. I am especially excited to have her. Her story has touched me in many ways, but when I really began to consider some of the impact that she's having in her career was at the RDH Under One Roof 2018 celebration, because
Yeah.
Samantha and I have had some interaction prior to that event, but it was her, I guess, her, I mean, she was just so touched by seeing Rhoda Publicus, who is a fellow Filipino hygienist, and her heart being touched by Rhoda touched Rhoda so much that she was crying. She was in tears because of the kind words that Samantha shared with her and the impact that Rhoda made in Samantha's professional career by seeing her being awarded as a fellow Filipino dental hygienist. So I just want to say, I am one that really truly loves our profession. I love our industry, but most importantly, I love having a diverse voice.
Yeah.
And so she's New Jersey bred,
Yes.
New York trained, holla.
Absolutely.
DMV living, Aligned Technology Hygiene faculty member, clinical writer, blogger, photographer, Soul Cycle, and puppies are things that she loves. Welcome to the show, Samantha.
Thank you, Jasmine, for having me.
I'm actually a little nervous.
I'm a little nervous.
We want to talk about your career as a dental hygienist and like what you've done and how you've gotten to speaking as a faculty speaker for Invisalign. Just tell us a
Yes.
little bit about what your career has been like. Well, for listeners that aren't watching this on YouTube, she's actually in an operatory.
I am. I'm in an
Amazing.
operatory. I thought it would be more like authentic, It's nice background. There's my
Yeah.
chair.
Yeah.
Making it work.
Yeah.
So my career as a dental hygienist, I just want to preface, and I always say this, but my start with patient care, I actually started off as an EMT at the age of 16, 17, but I had volunteered with my local rescue squad back home in New Jersey since I was 15. And I really loved patient care. I loved taking care of people. I did have, a family influence in dentistry. My cousin and her husband, they've been my dentist since I was 3. I have a lot of family. And it seemed very unique. I shadowed them one time at their office as I was about to start pre-clinic, just to kind of get a feel of like, how does the operatory work? How do they seat patients? How do they turn over rooms? And while I was, definitely interested in doing dentistry, like maybe being a dentist, I looked at their hygienist. I was like, well, what is she doing today? I like what she's doing because she gets to kind of be in her own world. Like nobody's bothering her. She gets to have some, interaction time with her patients. Like I want to know what she's doing. And I've ended up shadowing her more than my own cousin. And that's when I decided I wanted to do dental hygiene. And I found the program at New York University College of Dentistry. And from there, they were able to open up the possibilities of what could you do with your hygiene career more than just your routine, prophy, x-rays, like being a part of that program, being able to graduate from that institution. It really did enable me to see more with what I can do with my career. And I am forever grateful for anyone who I've met in that school, in that institution. A lot of great opportunities came from New York City. So that's where I got started.
That's awesome.
Yes.
That's so awesome.
So I originally had intended to attend that program to transition to their DDS program because there was something I can do in that sense. But once I started to pay a little bit more attention to what my hygiene professors were doing, I was more interested in what they were doing. I was, I like helping people. I like how they instructed the students and how they encouraged the students. And to me, that felt more valuable education. And I didn't really see myself doing that, but I followed it through and decided to finish off my bachelor's with a concentration in dental hygiene education. So that one day, I will go to a hygiene school and teach hygiene, whether it's a clinical instructor or, I get to teach a course. But then this thing happens with Invisalign, and I'm like, I don't know if I want to turn back and do that. I think I like this gig a little bit better. Because you have the advantage of being able to travel around different cities, meeting different dental professionals all around the country, listening to what dental assistants, dental hygienists, and doctors do with their patients, and it's a constant learning experience. You're not just there to teach people what to do and how to do it, but you also want to make it interactive, that you actually learn something from them and you take something away from that. And that's why I get so hyped up about those courses. And if you follow me on social media, I post like a Friday selfie of myself after the course, and I just let out everything that felt really good to me about that course.
Right.
And what I enjoyed the most, and what I tell my attendees. So that's I never saw myself doing that, but I'm really glad I took that path.
I love that you said that, because I just had a conversation right before our interview, and it was just, going with the flow with our career trajectory, not being impatient through the process, getting a chance to experience everything. Because just like you said, like you were like, oh, I was going to get into academia and I was going to teach. And all of a sudden, like, I'm in this whole different path now. Education still. You're still an educator, but it's completely out of the box of what you thought of. So like, how did you feel like you were prepped to do that? Like, what made you take that leap and say, you know what? Okay, I'm going to do this.
So it all really started so as hygienists, and I'm going to quote Alicia Murray here. I will always forever quote her. We're inflammation prevention specialists. So what can we do to help our patient, be rid of the inflammation? What can we do better, perio-wise, to help our patients? And for me, it came from the periodontal and malocclusion relationship and how that fit together. Because that's my passion. I've worked with a lot of great doctors. But there's one doctor, particularly Dr. Patel, who actually made me see it in that light. And he kind of enabled me to do a little bit more with Invisalign. And I started learning more and more about it. And I am still learning a lot more about it. Like I said, when you meet doctors and hygienists, you get to learn and network constantly with the people that you're with. That's where my speaking journey started. It's starting from a passion, and then from there on, networking. Because I'm gonna be perfectly honest. I think I was already practicing hygiene for maybe 4.5, 5 years, and everybody does experience this where they get a little burnt out. They wonder, is this kind of it? Like, what am I doing? And I was looking for a career shift. And because I was so well versed in Invisalign, I was so passionate about it. I was very passionate about the periodontal-Malocclusion relationship. I went up to my territory manager. I was like, can I please have your job? Like, what can I do to constantly stay in Invisalign and talk about it all day, every day? And she looked at me and she was like, you know what? I will do you one better. So she had taken my resume, and I have another doctor, Dr. Linda Jones-Laper. She pushed me to submit a topic for Invisalign Summit. I did not get picked, but that topic was the reason why I got to joining the Align faculty. And I was asked to train with them around late August 2017. So, a little close to 2 years now. And it was a lot to take in. It was a lot to getting used to. But being given the opportunity to shadow different Align faculty, especially hygiene faculty in that group, and listening to their speaking styles, even outside of Align, I remember even attending a couple of your Beyond the Prophy events, just to listen to other speakers, just to see what their speaking style is, how do they handle the crowd, what do they say. So I was more tuned into that, just so I can learn for myself on how to be a better speaker.
I mean, can I give you a round of applause? Because I don't really care if it's at my events or anybody else's events. Like, can we get out of the rut of just taking CE just for licensure renewal and realize that we can learn so much, not only the content, but just like you said, you're looking at people's teaching styles. And there's so much mentorship that we can get, not just by having conversations like this, but by observing other people. That's a form of mentorship, and getting that the information that you need to elevate yourself at some point, and to help others as well.
Yes.
I love that.
And then that's how I've always seen it. And I love mentoring. I find myself mentoring hygienists all the time, not officially, but I will, give them my contact information, and we'll exchange and check in every now and then. And eventually I'll make it a formal thing once I've figured out what I want and how do I want to do it. But it's a really good feeling, just to get to share experiences, because, no one should ever be alone in their dental hygiene journey. Just know that, we have a lot of support groups, whether you're on social media, or if it's you, Jasmine, it's Beyond the Prophy, if it's anywhere you are. I mean, there's always someone there who's willing to offer at least some support,
Amen.
Because it's very tough. It is very tough. We may make it look easy, but getting here was very hard. And, I have had people ask me, well, like, why? Funny enough, I have a team member here who wants to go to hygiene school, and she was like, it's like, so if I get my bachelor's, I can do what you do, right? I was like, yeah, you can, but I'll let you know, it took me about 6 years to get here. A lot of hard work and figuring out exactly what you want to do. As long as you're, persistent and you follow through with your goals, I think you can do anything with your hygiene career, honestly.
Yeah, even if you have an associate's degree, even if you have a bachelor's degree, even if you have a master's degree, it's all about leveraging the skills that you have. And that's why I just love the fact that you mentioned you are someone that is totally okay with continuously learning. One of the things we always talk about is being a lifelong learner. Well, that includes taking classes even when you don't technically need them, but they're there for personal and professional growth.
Yes.
I love
Absolutely.
that. So, all right. So let's go into talking about a little bit of some of the stuff that you're passionate about. You're passionate about malocclusion and how it relates to overall health for the patient, right? So tell us some of the things as far as periodontal health, airway health, we need to know and be aware of as dental professionals when it comes to that.
Without getting too deep into it, but it just begs the question, where do all of these things come from? For the past few weeks now, and I feel like I'm always crafting my messages for my attendees with my patients. What I have been saying recently, well, first of all, let's just start here. Let's just start with, I am a practicing hygienist. I see bleeding, I see bone loss, I see 5 millimeters, things that we're all like very in tune to, and we focus on just that. And that's the conversation we have with our patient. We're very good with educating our patients with the oral and oral health systemic link and how that all ties in together. But I find sometimes that we, even myself, before I even thought about malocclusion, is that you could get very focused on just the technical things, like why isn't this 5 millimeter pocket going away? Why is the bleeding still happening? And to think about what the patient's experience is like, because they're the ones who have the disease. They're the ones who have to manage it. We're just there essentially to, treat, support, and, be there for the patient, but we're not there with the patient. So what else can I do for my patient? I can go through the whole repertoire, but if you take a step outside of the box and take a look at the mouth as a whole, ask them to bite down. What do you see? Do we see crowding? Do we see a deep bite? Do we see an open bite? And understanding the mechanical forces. I talk to my patients about this all the time with how traumatic occlusion works, and the phrase of the month is leading the pathway, creating the pathway for periodontal pathogens to hide. And where does that come from? And for me personally, that I always think it's from some form of traumatic occlusion or malocclusion. It is absolutely not the cause of it, but it is certainly a risk factor. And it is definitely, like I said, the pathway to leading to periodontal disease and ultimately tooth loss. So being more proactive is super important in that situation. And, as I'm going around the country, speaking to my Align attendees, I always like to emphasize that. But that's where I feel like we can help improve perio, is taking a look at that. So that's one thing. Now, in terms of open airway dentistry, it's a very easy question. Well, let's look at the relationship of your upper and lower arches, and where is your tongue placement? What does that do? If, let's just say you have like a very narrow arch, very much smaller profile. I mean, is your tongue too big for your mouth? Is it too small for your mouth? Like, where it's a muscle. Where does it go if we don't have the proper, I always say, square footage? Like, where does that go and what does it lead to? So asking those questions and seeing if that's actually true. And I've been very grateful to attend a few courses on that, and I do learn a lot. So it gives me, I want to say, it gives me more perspective to what comprehensive dentistry is really like. Because comprehensive dentistry isn't just caries and perio. It is everything.
Absolutely.
It is everything. It is open airway dentistry. It is, autoimmune diseases. A lot of these things we have to take a look at. And I understand how it can get very hard with how much time hygienists are given to actually explain that. Some of us are given a half hour. Some of us are given 45 minutes. Some of us actually have an hour. And it's utilizing that time and trying to find a way to convey that message just so it's not forgotten. Like, we know all of this. It's not that we don't practice it. We don't, we know it, but we're just not, I feel like none of us are given enough time to talk about it to patients.
I almost feel like that is true to some extent, but then there's small segment of people. I always go back to our foundation.
Yes.
In school, they weren't talking about that. Malocclusion, airway health. So we've got to take in consideration that there's a huge, and even now, they're not really talking about that. Like, you may talk about it just a little bit when you're doing a quick check as an adjunct faculty and you're kind of helping them think outside of the box. But most students, the foundation is, like you said, perio, caries, is the bacteria, because when they are getting tested by these national boards, they're not asking them auxiliary questions about that. So I feel like there are hygienists like you, and then there's hygienists that they haven't had the pleasure of being educated by you and other people who are starting to think about some things out of the box. So they're still treating people based on, back in the day. The same teachings that we're still responsible for our boards.
And there's absolutely nothing wrong with that. I just, even for someone who's just fresh out of hygiene school and just practicing, like, take the time off to go to a continuing education course. If there's something that's interesting to you that you want to learn more about, follow through with it. if it conflicts with a work schedule, talk to your doctor about it, and you know how important it is to you, and you know, any information that you're learning, how can you utilize that into practice? You know, always be out there learning. I mean, that's my passion, periodontal disease and malocclusion. We have so many other hygienists out there who have passion for certain things, and that's just as valid. But it's all about going out there and getting it.
Yeah, absolutely. And we have to, because unfortunately, because of how our curriculum is based in school, we have no choice but to start venturing out and being educated by hygienists like you, so that we can expand our practice. I love that.
Absolutely.
All right. So we keep our episodes short, but I can't leave this episode without asking you this question. So
yes,
what was the best career advice or personal advice you've ever received?
Best career advice or personal advice I've ever received. It is definitely, well, there's one when I was an assistant in New York City. One is from a periodontist I used to work for, and I'm forever grateful for these two doctors in Tribeca in New York. One thing he did tell me was, learn everything you can in school. That's great, but as soon as you're done, unlearn everything, because you're gonna learn again. You're gonna have to learn the real world. And I know that's not like anything inspiring, but it's so true. Like, learn, that's great. Learn whatever you can from that institution, but as soon as you get out, unlearn everything. Unlearn everything and start over again. So that was from a doctor, and he's so great. I miss him so much. And my mom. So for every Friday, almost every Friday night, I will be sitting on the kitchen table with my mom talking about anything and everything. And I feel like all of the good advice and morals and things I learned, they just come from my mom. And there's just so much to list of what she's taught me. But, you know, just to generalize, and I can't, you know, really quote her, but just some of the things that my mom has taught me is to always, you know, be persistent, you know, follow through with anything that you do. Nobody's going to hand you anything, so you better go get it. Things that she says to me, she's like, you know what, one day mom's not going to be here, so you're going to have to figure it out. Some of them are words of tough love, but that's my mom. And I learned a lot of life lessons from my mom, and I use it, you know, throughout my career, and I remember those things. So, but those are some pieces of advice I've received from, you know, from an employer and my mother personally and professionally that I will always still remember.
Yeah, I love it. And that's why I love asking the question, because everyone has pearls that they've learned. Everyone has different things that have made an impact in their life. And I certainly appreciate you for sharing that. All right. So please tell me I know where to contact you, but tell the listeners how to contact you if they're interested in talking more with you and about your journey and the things that you love.
Absolutely. So I've enabled my my Instagram. It is now public. It's all dental inspiration and fun things like that. You know, a little bit about what I, you know, do for fun. But you can follow me on Instagram at truly_RDH. I also do have a blog / I guess professional portfolio. You can find some things that I've written, articles I've written for today's RDH. There's a fun section for that. A little bit of my photography, and that is at trulyrdh.com. Those are very easy ways to find me. LinkedIn, of course. You can find me through there. So I'm pretty much active on all of those, and I'm, you know, more than happy to help anybody out, and just even talk. Doesn't have to be, you know, how do I figure things out? I'm here. That's how we can find me.
Thank you, Samantha. Thank you so much for being on the show. I really appreciate you for taking the time out, sharing your story,
Absolutely.
sharing
Thank
your
you for
why.
having me.
Yeah, I'm
Thank you for having
excited.
me.
It's like finally.
I know once you asked me, I'm like, yeah, let's do it.
Yes. I was like, you know what? I was going through and I was like, man, I met all these incredible hygienists. It's time to get them on here. And I only have a short few of episodes each season, so it's like, I gotta get Samantha on. Like, we finally gotta get her on. So I'm happy that you're here today.
Yeah, I'm happy that I'm with you. And and the fact this is your third season,
Yeah.
that's a lot. That's
Yeah.
great.
Yeah. Thank you. I'm very excited. Yeah. All right. Well, thanks
Alrighty.
again for being on the show.
Okay, thank you.
See ya.
Bye.